The number of confirmed H1N1 flu cases continues to rise around the world. Several countries have reported new cases of the virus. On Sunday, Colombia reported South America's first confirmed case of the virus. This comes a day after Costa Rica reported the first case in Central America. The World Health Organization said there have been 19 confirmed flu deaths in Mexico and 1 in the United States. Mexico has also confirmed that 506 people have been infected with the virus, while the U.S. has confirmed 226 cases. In other parts of the world, there are 85 confirmed cases in Canada, 40 in Spain, 15 in Britain, 8 in Germany and 2 in France, 4 in New Zealand and 3 in Israel, and 1 each in Colombia, Costa Rica, Ireland, Switzerland, Austria, Italy, Denmark, the Netherlands, South Korea and China's Hong Kong SAR. The figures from the WHO sometimes lag behind national report about the virus, are considered more scientifically secure. A joint statement by 4 international organizations says pork products handled in accordance with hygienic practices are not a source of H1N1 infection. The 4 bodies are the World Health Organization, the UN Food and Agriculture Organization, the World Organization for Animal Health and the World Trade Organization. Their joint statement aims to alleviate rising concerns about the safety of pork and pork products. They say there is no evidence the virus is transmitted by food. Therefore, there is no justification for any anti-pork trade measures. Egyptian police on Sunday fired tear gas and clashed with irate farmers who were resisting the government's attempt to slaughter all of the nation's pigs. 12 people were injured. Cairo authorities said 14 people were arrested and 7 police were among the injured in the clashes near the capital. Police were sent in after farmers resisted initial efforts by government workers to haul their pigs away. Egypt last week ordered the slaughter of all the country's 300,000 pigs. This is despite no cases of H1N1 flu being reported there. The World Health Organization has said this is unnecessary because the virus is being spread through humans. No new H1N1 flu cases have been discovered in Hong Kong, and all passengers who flew with the Mexican man who tested positive have been located. The Mexican man arrived in Shanghai Thursday on an Aero-Mexican flight and changed plans to go to Hong Kong. So far, none of the passengers quarantined in China have shown flu symptoms. Yang Wei-Han has more.
Hong Kong's only H1N1 patient is in isolation and in stable condition. At the Metro Park Hotel in Hong Kong, where the man had been staying, authorities are tending to the 350 guests and staff who remain quarantined there. Passengers who took the same flight from Shanghai to Hong Kong are currently under medical observation and in stable condition. They have not shown any symptoms such as fever or coughing.
The people quarantined are all in good health. If any of them feel uncomfortable physically or mentally, we will send him or her to hospitals for a checkup.
Local health authorities are searching for people who had contact with the Mexican man, but there is no evidence that the virus has spread into the local communities. Meanwhile, all the passengers aboard Thursday's flight from Mexico City to Shanghai have been located, and those who remained in China were quarantined. China's health ministry said none of the passengers had shown flu symptoms as of Sunday noon. The ministry said China had redoubled its prevention and control efforts. A joint action has been carried out by the health, financial, communication, quality supervision departments at all levels.
An emergency mechanism has been carried out. We are now working in a coordinated way, sharing information, responding actively, in a bid to prevent the spread of the virus in a joint effort.
The Health Ministry has issued a guideline for preventing and treating the H1N1 cases. China has also developed its own method of making quick tests for the virus, which takes just 12 hours. The China Center for Disease Control is training staff from epidemic monitoring stations across the country to do the test. Yang Wei-Han, CCTV.
China has put on hold charter flights to pick up approximately 120 Chinese citizens stranded in Mexico. China's Southern Airlines said the plane left for Los Angeles on Sunday night, but it would not fly to Mexico as earlier planned. The Guangzhou-based airline added that it was ready for the mission, but it was up to the government to implement it. Following the outbreak of the H1N1 Flu virus, the Chinese government suspended flights from Mexico to Shanghai. It says flights will resume depending on the flu situation.
Welcome to a weekend edition of Asia Today. I'm James Chow with a half hour of all the latest. And starting this program, Thailand says the ASEAN +3 health ministers meeting will take place this week. The talks in Bangkok will find new ways of tackling the H1N1 flu. ASEAN +3 includes 10 ASEAN member countries and China, Japan and South Korea. Thai Prime Minister Abhisit Jajiwa is confident that the meeting will strengthen regional defence against the new influenza and will also be an opportunity to show determination to fight the disease. The Thai government has stocked up on antiviral drugs and taken measures against this sickness, but Abhisit says people must wash their hands frequently and pay attention to good personal hygiene. Well, at this point in the program, let's look at the global picture because the H1N1 flu outbreak has now infected people in as many as 16 countries and regions. Hospitals in the Indian city of Mumbai have taken preventive measures. Earlier this week, the federal government issued an alert across India. 6 passengers who showed symptoms of fever and a common cold after returning from trips abroad have been quarantined at a hospital in the capital, New Delhi. Among them, 5 have tested negative, and the result of the 6th has yet to be confirmed. The Kasturba Hospital in Mumbai has screening machines to test people who are suspected of carrying the virus. Health Ministry officials say there's no confirmed case of H1N1 flu. Former Federal Minister of Health Anbumami Ramados said he hopes that the virus could be contained as it wouldn't survive the high temperatures that India is presently experiencing.